Hello, it's Dr. Leroy Butler at the Orthopedic Institute of North Texas again, and today we are talking about foot and ankle fractures. All right, so when do you suspect you may have a foot or ankle fracture? Obviously, if you've had some trauma, a twisting injury, or you stepped awkwardly on something that has caused pain in your foot or your ankle, usually associated with swelling, obviously pain. If this kind of resolves, in a very appropriate amount of time, like let's say the next day or so, you feel a lot better, then there's a chance you may not have a fracture. But if this swelling and pain persist, then I would recommend being seen to rule out that you do not have a foot or ankle fracture. Sometimes even people say they heard a pop or a snap associated with the injury, then that would usually mean that you may want to have it looked at, especially if you have a considerable amount of pain or swelling associated. Sometimes people come in to see me and I will tell them they have a fracture. And then lots of times that kind of gets lost in, is it broken? Is it fractured? To an orthopedic surgeon, that means the same thing. If you have an adult skeleton and the bone has a crack in it, or what we call a fracture, which is the technical term for it, but that also means that the bone is broken. The bone can be broken, but it can be in the same place of where it's supposed to be, meaning anatomically in the same place, and your foot still looks normal, like this diagram, and the bones are lined up the way they're supposed to be. We call that a non-displaced fracture. Lots of times non-displaced fractures can be treated conservatively, meaning without surgery. And that usually means that sometimes we need to immobilize you, and that's from a foot standpoint, that could be in a post-op shoe, which is a hard sole shoe that allows for you to sometimes put weight on it. Sometimes we take you off of your foot to help with pain, discomfort, and also to decrease a risk of the fracture moving or displacing. And then we take you off your foot, put you on crutches, or even sometimes a knee scooter. If your fracture is displaced, meaning that it's no longer aligned where it should be, then sometimes we need to discuss, do you in the office need to straighten and line that back up to a better position? Or sometimes there is a need for surgical talk if this fracture is deemed to be unstable, or if it's a significant bone that is a major portion or key to your foot stability, then sometimes we need to fix those fractures. Or sometimes, even if it is displaced, you don't always need surgery. You just may need to also still be immobilized and taken off of your foot or your ankle. All right, so let's just say you're seen, examined, and we deem that we recommend surgical care for your particular fracture in your foot or your ankle. And assuming that you would like to move forward with that, postoperative treatment for your procedure, usually you're in a splint, a cast sometimes, or even a postoperative shoe or boot after surgery. Depending on how we fixed your fracture or the stability of your fracture, you may still be non-weight bearing on crutches or a knee scooter. We also tend to keep you off your foot for most procedures after fixing your fracture, and that's also to decrease the swelling, protect the wound, because obviously you'll have an incision for the procedure, and that will decrease any risk of having postoperative infection. Or even lots of patients come to me and they believe that once you put hardware, which usually is plate or screws, that you can put weight on it, but most people fail to realize that your skeleton is actually stronger than most hardware that we put in to your foot or your ankle to fix it. Therefore, if you walk on it too early before your orthopedic surgeon says that you can walk on it, then sometimes you can break through the hardware, which unfortunately could set you up for procedures in the future to either fix the broken hardware or take the hardware out. If you suspect that you have a foot and ankle fracture, then I would recommend at least being seen, because like alluding to what I said earlier in this video, if you have a displaced fracture and if this changes the alignment of your foot or your ankle, or even if you have a fracture that involves the actual joint of certain joints throughout your foot and your ankle, as you can see in this diagram, there are multiple bones, multiple joints, and sometimes fractures into these joints or malalignment at these joints if not treated either conservatively or surgically early on, then that can lead you to either postoperative arthritis, or they can lead to deformity within your foot and your ankle, which sometimes will lead you to having a much larger or more involved procedure in the future, which may not have been necessary if seen early on in the care treatment. All right, and that's a wrap on foot and ankle fractures. But if you feel as though you have a foot and ankle fracture that you need to be seen, that may hopefully not need surgery, or even just needs to be treated conservatively to prevent any future issues within your foot and your ankle, we would be happy to see you at the Orthopedic Institute of North Texas.